Picture yourself on a Saturday morning just beginning to stir awake. You stretch your arms above your head, feeling the pleasant pull of muscles loosening after a night's rest. Then you extend your legs, pointing your toes downward in that satisfying full-body stretch. Suddenly, without any warning, your calf muscle seizes like it's been grabbed by an invisible fist. The pain is instant, brutal, forcing a gasp from your throat as you clutch at your leg in the dim morning light. What if I told you that not all leg cramps are created equal, that some of these painful episodes aren't just annoying muscle spasms but red flags your body is waving frantically, trying to get your attention before something serious happens? Here's a statistic that should wake you up faster than any midnight cramp ever could. Nearly 50% of Americans over 60 experience leg cramps regularly. That's 1 in every 2 people your age. But here's what most don't know: for up to 20% of those experiencing frequent leg cramps, there's an underlying medical condition hiding beneath the surface, silently progressing while we blame dehydration or overexertion. Do you know the difference between a benign muscle cramp and one that signals nerve damage, circulation problems, or even a blood clot working its way through your veins? Let me share something that haunts me from my 40 years in geriatric medicine. We've been taught for decades that leg cramps are just part of getting older, a nuisance to endure with some stretching and water. Myth number 1: all leg cramps are harmless and will resolve on their own. The truth: some leg cramps are your body's alarm system, and ignoring them is like disconnecting a smoke detector because you're tired of hearing it beep. Myth number 2: if a cramp goes away after a few minutes, there's nothing to worry about. Reality check: the cramp itself might disappear, but if it's caused by restricted blood flow or compressed nerves, the underlying danger remains, growing worse with each passing day. Myth number 3: leg cramps only happen at night when you're sleeping. Wrong again. Some of the most dangerous types of cramps strike during the day, triggered by walking or simple activities, signaling that your muscles aren't getting enough oxygen-rich blood. Now, before I go any further, let me tell you about a patient whose story changed how I talk about leg cramps forever. Her name was Margaret, a vibrant 66-year-old grandmother from Denver. She loved hiking, playing with her grandchildren, and tending her garden. But over several months, she started experiencing leg cramps that felt different from anything she'd had before. They were intense, radiating up from her calf into her thigh. Sometimes they lasted 15, even 20 minutes. Instead of just nighttime episodes, they started happening during her morning walks. She'd have to stop, lean against a tree, waiting for the pain to subside. Margaret did what so many of us do. She told herself she was just getting older, maybe needed to drink more water, stretch more often. She mentioned it casually to friends who said they had cramps too, everyone nodding in shared understanding of one of aging's little indignities. Then came the day that changed everything. Margaret was walking up her driveway carrying groceries when a cramp seized her leg with such ferocity she dropped everything and collapsed right there on the pavement. This time the pain didn't ease after a few minutes. Her leg felt heavy, almost numb, and when she finally made it inside and looked down, she noticed something that sent ice through her veins. Her calf was swollen, the skin discolored with a reddish tint she'd never seen before. That grocery trip ended with an ambulance ride and an emergency room diagnosis that could have cost Margaret her life if she'd waited even another day. But I'm getting ahead of myself. Stay tuned, because what doctors discovered in Margaret's case reveals a crucial truth every person over 60 needs to understand about leg cramps. Welcome back to Verum Health Podcast, where every episode helps you stay strong, independent, and sharp as you age. I'm Dr. Samuel Harrison, and I've spent over 4 decades specializing in geriatric medicine right here in the United States, working with thousands of patients navigating the health challenges that come with our golden years. Today we're diving deep into a topic that affects nearly half of you listening right now: leg cramps. But we're not talking about simple remedies or quick fixes. We're talking about the 5 warning signs that separate a harmless muscle spasm from a medical emergency that requires immediate attention. Because the truth is, your leg cramps might be trying to save your life. Comment yes if you've experienced mysterious leg cramps that worried you, and subscribe to Verum Health for free tips that could add years to your life and life to your years. Because what you're about to learn in the next few minutes could be the difference between a minor inconvenience and a major health crisis. Margaret Chen wasn't just any patient who walked through my office doors. She was a second-generation Chinese-American from San Francisco, a retired high school teacher who had spent 35 years shaping young minds in the Bay Area. At 66, she was exactly the kind of patient who embodied what I call active aging. Every Sunday, she took her twin granddaughters to Golden Gate Park, pointing out birds and teaching them about nature. She volunteered at the community library twice a week, and those morning walks, they weren't just exercise. They were her meditation, her quiet time before the day began. But something had shifted over the past 6 months, and Margaret had convinced herself it was simply the price of getting older. The first cramp came on a Tuesday morning during her usual 2-mile route through her neighborhood. Her right calf seized up with a sharp, twisting pain that forced her to grab onto a fence post. She stood there, breathing hard, massaging her leg until the muscles finally released their grip. 10 minutes later, she continued her walk, shaking her head at this unwelcome reminder that she wasn't 20 anymore. What Margaret didn't know, what so many of us don't realize, is that our bodies speak a language we've forgotten how to understand. Every symptom is a word, every pattern is a sentence, and some messages are urgent telegrams we ignore at our peril. Over the following weeks, the cramps became more frequent. They started waking her at night, jolting her from sleep with that familiar, searing pain in her calf. She'd stumble to the bathroom, trying to walk it off, stretching her leg against the wall like she'd read online. Her husband would wake to find her pacing the hallway at 3 in the morning, and she'd wave him off, saying it was just a cramp, go back to sleep. During family dinner one evening, Margaret's daughter noticed her mother wincing as she stood to clear the table. When asked about it, Margaret brushed it off. "Everyone gets leg cramps," she said. Her sister got them. Her friend Joyce from book club complained about them constantly. It was just part of being over 60, wasn't it? They all laughed, commiserating about the indignities of aging bodies, and moved on to dessert. But here's what Margaret didn't mention, what she barely admitted to herself: the cramps were changing. They weren't just nighttime nuisances anymore. They were happening during her walks, forcing her to stop more and more frequently. The pain was lasting longer, sometimes 15 or 20 minutes before it fully subsided. And something else was different. The pain didn't just stay in her calf. It radiated upward, spreading through her thigh like electricity following a wire. Margaret started modifying her life around these episodes. She stopped volunteering at the library because it required too much standing. She told her granddaughters that Grandma was tired, maybe next week for the park. She began taking the elevator instead of the stairs in her apartment building. Each accommodation felt minor, just a small adjustment for comfort. But add them together, and Margaret was slowly losing the independence she treasured. This is what happens to thousands of seniors across America every single day. We adapt, we compensate, we tell ourselves stories that make sense of our changing bodies, and sometimes those stories keep us from seeing the truth until it's almost too late. The morning Margaret collapsed in her driveway carrying groceries, she'd already experienced 3 cramps during a short walk to the store. The fourth one hit differently. Her leg didn't just cramp, it felt heavy, almost dead. When she looked down after dragging herself inside, her calf was swollen to nearly twice its normal size. The skin had a reddish-purple discoloration she'd never seen before, and when she touched it, it felt hot, almost feverish. That's when Margaret finally called 911, her hands shaking as she dialed. That's when a routine leg cramp transformed into a medical emergency. Because what Margaret had been experiencing wasn't just simple muscle spasms from dehydration or overexertion. Her body had been screaming warnings for months, and she'd been speaking the wrong language to interpret them. Stay tuned to discover the science behind what was really happening in Margaret's legs and why her story represents a critical lesson that every person over 60 needs to understand about the difference between harmless cramps and medical red flags that demand immediate attention. When Margaret arrived at the emergency room that afternoon, the attending physician took one look at her swollen, discolored leg and immediately ordered an urgent ultrasound. What they found would validate every moment of pain Margaret had endured over those 6 months and explain why her body had been sounding alarm bells she'd chosen to ignore. Margaret had developed a deep vein thrombosis, commonly known as DVT. A blood clot had formed in one of the deep veins running through her calf, partially blocking blood flow and causing the exact symptoms she'd been experiencing: the cramping pain, the swelling, the discoloration, the warmth radiating from her leg. Let me explain what happens inside your body when a DVT develops, because understanding this mechanism could save your life. Your veins are essentially highways that carry blood back to your heart. Deep veins run through the center of your legs, surrounded by muscle. When blood flow slows down, when the vessel walls become damaged, or when your blood becomes more prone to clotting, you create what we call Virchow's triad, the perfect storm for clot formation. According to research published in the American Journal of Medicine in 2023, adults over 60 are 5 times more likely to develop DVT than younger adults. The risk doubles again after age 75. Why? Because as we age, several factors converge. We tend to move less. Our blood vessels accumulate damage, certain medications increase clotting risk, and conditions like diabetes or heart disease create inflammation that makes blood stickier. Here's the terrifying part that Margaret didn't know until it was almost too late. That blood clot sitting in her leg wasn't just causing pain. It was a ticking time bomb. At any moment, a piece of that clot could break free, travel through her bloodstream, and lodge in her lungs, causing what's called a pulmonary embolism. This complication kills nearly 100,000 Americans every year, many of them seniors who thought they were just dealing with routine leg cramps. But deep vein thrombosis is only one of the dangerous conditions that can masquerade as simple leg cramps. The second major culprit is peripheral artery disease, or PAD. This condition affects approximately 8 million Americans over 60, and many don't even know they have it. With PAD, the arteries that carry oxygen-rich blood to your legs become narrowed or blocked by plaque buildup, the same process that causes heart attacks when it happens in coronary arteries. When your leg muscles don't get enough oxygen during activity, they cramp. We call this claudication, and it's your muscles literally crying out for oxygen they're not receiving. The pain typically starts during walking and eases with rest, a pattern that should immediately raise red flags. A landmark study from the Journal of the American College of Cardiology in 2022 found that seniors who ignored claudication symptoms for more than a year had a 40% increased risk of heart attack or stroke. Because if the arteries in your legs are clogged, chances are the arteries feeding your heart and brain are struggling too. The third dangerous condition hiding behind leg cramps is nerve compression, particularly from conditions like spinal stenosis or sciatica. Your sciatic nerve is the longest nerve in your body, running from your lower back down through your legs. When it becomes compressed or irritated, it can cause cramping pain that radiates from your back all the way to your foot. Unlike simple muscle cramps, this neurological pain often comes with numbness, tingling, or a sensation that part of your leg has gone to sleep. Research from the Journal of Neurology in 2024 showed that nearly 30% of adults over 65 experience some form of nerve compression in their lower spine. Left untreated, this can lead to permanent nerve damage affecting your ability to walk, maintain balance, and live independently. But this is only half the truth. These three conditions, DVT, PAD, and nerve compression, represent the dangerous undercurrent beneath what many dismiss as ordinary leg cramps. The real question isn't just what causes these cramps. It's how do you tell the difference between a harmless Charlie horse and a medical emergency? That's what we need to explore next, because the answer could mean the difference between a simple inconvenience and a life-threatening crisis. Every single day in America, approximately 1,000 people develop a deep vein thrombosis. That's one person every 90 seconds. And here's the statistic that should make every senior sit up and pay attention. Up to 30% of people who develop DVT have no obvious symptoms beyond what they dismiss as routine leg cramps. Think about that for a moment. Picture a movie theater filled with 300 seniors. If all of them experienced leg cramps this year, roughly 90 would have an underlying condition that needs medical attention. But how many would actually seek help? How many would shrug it off as just another sign of aging, another inconvenience to endure? The healthcare burden of misdiagnosed or ignored leg cramps is staggering. According to the Centers for Disease Control, treating complications from DVT and pulmonary embolism costs the American healthcare system over $10 billion annually. But the human cost is even more devastating. Families lose grandparents, spouses, friends, not because we lack treatments for these conditions, but because symptoms were ignored until it was too late. Peripheral artery disease tells a similar story. 8 million Americans over 60 live with PAD, but studies suggest that number could be twice as high. Because so many cases go undiagnosed, people attribute their leg pain to arthritis, old age, or being out of shape. They slowly restrict their activities, walking less, moving less, until their world shrinks to the confines of their home. The sad irony: movement is exactly what helps prevent PAD from worsening. Imagine a garden hose that's been kinked. Water struggles to flow through. That's your arteries with PAD. Now imagine using that hose less and less because it's not working properly. The water inside becomes stagnant. That's what happens when PAD forces you to become sedentary. You enter a vicious cycle where reduced activity accelerates the very condition causing your pain. This is happening in communities across America right now. In retirement communities from Florida to Arizona, in small towns throughout the Midwest, in urban apartments in New York and Chicago, seniors are experiencing leg cramps. They're not reporting to their doctors. They're canceling plans with grandchildren. They're giving up hobbies they love. They're surrendering independence one small accommodation at a time. The World Health Organization released a report in 2023 highlighting what they call the silent epidemic of mobility loss in aging populations, and leg cramps that signal underlying vascular or neurological problems. They're one of the earliest warning signs that mobility is at risk. Yet they remain one of the most underreported symptoms in geriatric medicine. But here's the hopeful truth buried in these sobering statistics: these conditions are largely preventable and highly treatable when caught early. DVT can be prevented with proper movement, hydration, and in some cases medication. PAD responds remarkably well to lifestyle changes, particularly diet modifications and structured walking programs. Nerve compression can often be managed with physical therapy and targeted exercises. The key is recognizing when your leg cramps have crossed the line from benign to dangerous. Your body is constantly communicating with you through symptoms. The question is, are you listening? Are you fluent enough in your body's language to recognize when a cramp is actually a cry for help? Think of your body as a house with a sophisticated alarm system. Sometimes the alarm goes off because a leaf blew against a window, harmless and temporary. But sometimes it's warning you that an intruder is breaking in. The alarm sounds the same either way. You need to know which signals require immediate action and which ones just need acknowledgement. So let's talk about the 5 warning signs that separate normal leg cramps from medical red flags that demand your attention. These are the signs that should send you to your doctor without delay, the signals your body uses when it's moved beyond gentle hints into urgent warnings. Warning sign number 1, cramps that last longer than 10 minutes or don't respond to stretching and massage. A typical muscle cramp, the benign kind, usually releases within a few minutes. You stretch, you massage, you walk it off, and it resolves. But when a cramp persists beyond 10 minutes despite your best efforts, or when it keeps returning in waves, that's your body telling you something deeper is wrong. This pattern suggests possible circulation problems or nerve involvement that needs professional evaluation. Warning sign number 2, pain that radiates from your lower back down through your leg following a specific pathway. This is classic sciatica or nerve compression. Unlike a muscle cramp that stays localized in one area, nerve pain travels. It might start in your lower back or buttock and shoot down the back of your thigh past your knee, sometimes all the way to your foot. If your leg cramp comes with this radiating quality, especially if you also experience tingling or numbness, you're dealing with a neurological issue that requires medical attention. Warning sign number 3, swelling accompanied by visible changes in your veins or skin discoloration. This is the red flag that could have alerted Margaret much earlier if she'd known to look for it. When one leg swells noticeably larger than the other, when you can see enlarged veins bulging beneath the skin, when the skin takes on a reddish, purplish, or bluish hue, you're looking at possible DVT. Add warmth to the touch and you need to seek medical care immediately, ideally in an emergency room. This is not a wait until Monday situation. Warning sign number 4, numbness or complete loss of sensation in part of your leg. A normal cramp hurts, but you can still feel touch and pressure. When a cramping episode is accompanied by areas of numbness, when parts of your leg feel like they've fallen asleep and won't wake up, when you lose sensation in your foot or toes, you're dealing with nerve damage or severe circulation problems. This symptom requires urgent evaluation because prolonged nerve compression can lead to permanent damage. Warning sign number 5, cramps that occur during the day, triggered by walking or other activity and relieved by rest. This is called claudication, and it's the hallmark of peripheral artery disease. If you find yourself having to stop walking because of leg pain, if you need to rest frequently during activities that used to be easy, if climbing stairs consistently triggers cramping that eases when you stop, your leg muscles are starving for oxygen. PAD needs treatment not just for your legs, but because it signals increased risk for heart attack and stroke. Now let me give you a practical daily action plan if you're experiencing any of these warning signs. First, document your symptoms. Keep a simple log for 1 week, noting when cramps occur, how long they last, what you were doing when they started, and any accompanying symptoms like swelling or numbness. This information is gold for your doctor. Second, measure your legs. Use a soft tape measure to record the circumference of each calf at its widest point. If one leg measures more than 2 centimeters larger than the other, that's significant swelling that needs medical attention. Third, perform a simple color and temperature check. Compare your legs visually. Look for differences in color or visible veins. Touch both calves and compare warmth. Asymmetry matters. One leg that's warmer, redder, or more swollen than the other is never normal. Fourth, test your sensation. Gently touch both legs with a blunt object like a pen cap. Can you feel it equally on both sides? Any areas of numbness or reduced sensation should be noted and reported to your doctor. Fifth, schedule a doctor's appointment within 48 hours if you identify any of the 5 warning signs we discussed. Don't wait for it to get worse. Don't convince yourself it's nothing. Early intervention is the difference between simple treatment and serious complications. But prevention is always better than treatment. Here's your actionable checklist to reduce your risk of dangerous leg cramps. Stay hydrated by drinking at least 8 glasses of water daily, more if you're active or in hot weather. Move regularly, aiming for at least 30 minutes of walking most days of the week. Avoid sitting or standing in one position for longer than an hour without moving. Elevate your legs for 20 minutes twice daily to improve circulation. And stretch your calf muscles gently before bed each night. Now for the critical safety warning: if you experience leg pain with sudden shortness of breath, chest pain, rapid heartbeat, or coughing up blood, call 911 immediately. These are signs that a blood clot may have traveled to your lungs, a life-threatening emergency called pulmonary embolism. Do not drive yourself to the hospital. Do not wait to see if it improves. Call for an ambulance right away. You should also consult your doctor before starting any new exercise program if you have a history of blood clots, heart disease, or vascular problems. And if you're planning surgery or a long flight, talk to your doctor about whether you need preventive measures against blood clots. Remember that alarm system we talked about at the beginning. Your body's alarm has been ringing all along. The question was never whether it works. The question was whether you'd learn to recognize which alarms demand immediate action. Let me tell you the end of Margaret's story because it carries a message every one of you needs to hear. That emergency room visit saved Margaret's life. The doctors started her on blood thinners immediately to prevent the clot from growing or breaking free. They fitted her with compression stockings and created a careful plan to dissolve the clot safely over several weeks. But here's what moved me most. 3 months later, Margaret came to my office for a follow-up visit. She walked in with her twin granddaughters, 8 years old now, each holding one of her hands. Margaret told me that the scariest part of her experience wasn't the pain or even the emergency room visit. It was realizing how close she'd come to not being there for these girls, how her refusal to listen to her body's warnings had almost cost them their grandmother. But then Margaret smiled and said something I'll never forget. She said she felt grateful for that day in her driveway when everything came crashing down because it forced her to pay attention. It taught her that her body wasn't betraying her with these symptoms. It was trying to protect her, trying to save her, speaking a language she'd finally learned to understand. Today, a year and a half later, Margaret walks 3 miles every morning. She volunteers at the library again. She takes her granddaughters to the park every Sunday without fail. And whenever someone mentions having leg cramps, she stops them right there and asks 5 questions. Do they last longer than 10 minutes? Do they radiate from your back? Is there swelling or discoloration? Do you feel numbness? Do they happen when you walk? Those 5 questions have already sent 2 of Margaret's friends to their doctors, and both were diagnosed with conditions that needed treatment. Margaret jokes that she's become the neighborhood leg cramp detective, but there's nothing funny about the lives she's potentially saving by sharing what she learned the hard way. So here's what I want you to do today, right now. First, if you're experiencing any of the 5 warning signs we discussed, make a doctor's appointment. Don't wait until next week or next month. Your symptoms deserve attention today. Second, share this information with someone you love. Talk to your spouse, your siblings, your friends in your bridge club or golf group. Make leg cramp literacy your new mission, because chances are someone in your circle is dismissing symptoms that need medical evaluation. Third, start that symptom log we talked about. Even if your cramps seem benign right now, documentation helps you spot patterns and changes. Your future self will thank you for the information. Imagine 6 months from now looking back on today as the day you took control of your health. Picture yourself active, confident, free from the fear that every leg cramp might be something dangerous because you've learned to tell the difference. See yourself hiking with grandchildren, traveling without worry, sleeping through the night without painful interruptions. That future is within your reach, starting with the simple decision to listen to your body's wisdom. Like this episode if it helped you understand your leg cramps better. Comment below with which warning signs surprised you most, or share your own leg cramp story so others can learn from your experience. Subscribe to Verum Health and hit that notification bell so you never miss an episode that could add years to your life and quality to those years. Because your health is your greatest wealth and protecting it starts with knowledge. This is Dr. Samuel Harrison reminding you that every symptom is a message, every pain has meaning, and your body is always on your side, trying to keep you healthy, strong, and independent for all the years ahead. Listen to it, honor it, and when it whispers warnings, have the wisdom to pay attention. Take care of yourself, and I'll see you in the next episode.